of you think nurses, because you're all pretty much nurses except Ratan and Anu are sitting here quietly. I tried to get Ratan on stage, but he declined. He said nurses know everything. So next time you hang out with Ratan, hold him accountable for this. But how many of you think that majority of your work is driven by technology? How much of your work is inefficient? 20%? Ajita, all your work is efficient, huh? 100%. 40 to 50%. Fair? Fair? How much of that work is because it's a technology tool that has not helped you make your life better? A calculator makes our life better. Having a phone that's on your, a camera that's on your phone makes your life a little bit better, right? Versus you used to carry this big dabba around and hope nobody steals it from around your neck or when you leave it on a table in a cafe. Go ahead. Okay.
They are struggling actually. That is because the right implementation doesn't happen.
Okay.
And right technology, choosing the technology, all that is important. So technology definitely has made our life better everywhere. Gone are those days we were standing in queue in railway stations and...
Really? So when you go home and you see your, in your case not, but when you go to your office in a meeting and you see everybody looking at their phone, it's made life better.
Not really, not really.
Right?
I am not happy with that.
If you remember the last time the Pope was coming into play, everybody had their phone. They weren't looking at the Pope coming in and giving the speech, yes. Right? So the reality is there is no clear answer. We're going to try and bridge that in our session. We're going to have a little bit of an interactive session because there's a combination of clerical paperwork where ma'am is going to cover. There is clearly a tech side of it as well as a training side of it, which our other hosts are going to cover. So we're going to do this a bit interactive. We will start with the presentation. So ma'am, please feel free to go ahead. And then we'll come back and see how we link the two together, because at the end of the day, the customer has to feel better, right? And to a large extent, you are the internal customer. The nurse is the internal customer of the hospital. You represent over 70% of the population in a hospital. So you are the first internal customer. So next time a hospital chooses a tech tool, if there is no nurse that plays a key role in choosing it, there is a fundamental question. And I think this is to your point, Ajita, on the dot. But I think, ma'am, why don't you take? So I'm going to be a bit hard with the buzzer. 4 minutes?
Yeah.
4 minutes. Go for it.
Thank you so much, Mr. Mehta. And it is true that at times, in the end of the day, when I pick up my mobile, I feel that why it is there. It is a curse in the life, so it better throw it. So that is the actual reality. I don't know for me and maybe some leaders, but may not be for all. For me, it is really, at times I feel like I will vomit if I hold any more my phone. So it is so distracting. Coming to my topic talks about, can I have the display please? Are we increasing the paper burden despite technology? What do you feel? I'm asking the audience before I go to the next slide. Are we increasing the paper burden despite technology? Yes or no? Majority says yes? Okay, so end of my presentation, I will again ask the same question.
No, it's defective here. No, it is defective.
So let us see what nurses expect from technology. That's very, very important. As Ajita was saying rightly, that we know in a right kind of environment, for the right need, whether we know that what technology that we need in a right perspective is very, very important. Otherwise, it becomes a burden for us. Similarly, the nurses also expect certain things from the technology, and we all know how to operate our mobile, and that's how today's nurses are more tech savvy, by which technology actually allows the nurses to learn about simplifying their task, streamline workflows, multiple entries can be avoided. They can go for auto-population of the records, which will from the HIS or from the MedMant or whatever this software you have. From there, the auto-population of patient records. So which will help them to not to go for so much of entry of the records repeatedly. And then it enhances patient safety in terms of reducing medication error, in terms of tracking the errors and tracking the incidences so that it can be effective. It can give us a mileage to see where we are going wrong, and repeatedly in some units we are going wrong. So there are a lot of advantages for tracking the incidences or tracking the type of data that you want to actually retrieve for analysis. And it also helps us, gives us an alarm for abnormal reports. So we can have a lot of such things which nurses expect from technology. Like barcode scanner is again another thing which helps in medication administration, which helps in having error-free blood sampling, and a lot of such things. Go to the next slide, please. But we all know that how paper is prepared from the trees, we know that. And cutting trees, actually, we are increasing the burden that is the global burden that we are increasing. But let me tell you the incidences that are happening because how the paper burden is increasing. The global consumption of paper and cardboard in 22 study, it said that it was 414.19 million. But it is going to be increased, and which increased from last 10 years of 75%. But even then, if we see in near future, 2030, what is going to be the paper burden? It's going to increase to another 460 million, despite technology is advancing every day. And if we see, China is the one who maximum produces the technology. They are advanced in technology, but they are the highest generator of cardboards and papers in the country, in the world, and being United States being the second one. So imagine the amount of paper burden is increasing for the best countries who are having the technology, most advanced technology in place. So now the global burden increased, and we can see that still paper is taking over. Every day that technology is advancing, paper is taking over. And if we come to the impact on the children, even how technology is impacting in the children, there are positive and negative impacts. In positive impacts, it is like educational opportunities, increasing creativity, improving their communication skills, socialization is reduced, but entertainment. But negative is addiction and dependency, poor academic performance, social isolation and behavioral issues, developmental problems, and online risk. And we all know our children are facing like this every day, in and out. I think all parents are facing this problem which our children are coming across. But pretty soon, lawyers discovered that printed paper is useless with no actual handmade signature. Do you believe that? Big companies found the digital 500 pages report makes no sense until at least one copy is printed. So many such legal papers, we need one copy to be printed. Then only we go for signature. We don't actually, the e-signatures are not to be counted. Next slide, please. So an impact on technology, you can see the small to smallest child, you can see in the picture, they are sitting with the technology. That's the way they are being brought up now. They are taking all the technologies in their hands, the mobile, the laptop, the pump top, everything is there in their hands, and they know how to operate it. Next slide, please. So in 22, there was a study by Deloitte which says 79% of surveyed executives said that 59%, there is a paper increase by 59% compared to previous year. And however, 88% agreed that with immediate action, we can limit the worst impacts of climate change. By identifying these wasteful paper-based habits and adopting digital solutions, business can reduce their environmental impact, improve efficiency, and save money. So you can see that how the business lines are also changing in e-signature and digital solutions. Next slide, please. So see, there are some activities we nurses keep on doing, like onboarding documents, training manuals, legal documents, and going digital for a greener future. We all keep on doing that, more of digitally nowadays, and less of paper. But even then, paper burden is increasing day by day. Next. So after all, it was paper that allowed us to record events without leaving our history to be passed down orally from generation to generation. And it is the technology that helps spread the Bible. So this is the book. It talks about paper paging through history. If you get this book, please read it. You will come to know how paper made the history in the world. Thank you very much. So now I am asking everyone, what do you feel after my presentation? Paper is important or technology is taking over, paper is taking over the technology?
We'll come to that in the discussion session, ma'am. I think in order to have a little bit of time that we save up for the next session, Sonali, why don't you go and hit the thing and share some good ideas on success at MSR. Ma'am, you're clearly not a shareholder in a paper industry.
Can we have the slides, please? Good evening to all. I'm here to share some of the success stories in India about the technology used by nurses. So to begin with, I'll keep this very simple. I've got technology use success stories from clinical aspect, from public health nursing aspect, and from education aspect. I've tried to include all. We have few. So I think EHR is something that we all are aware. I think Columbia Asia was the first hospital in Bangalore I know which went paperless. And now it has become part of Manipal. It is helping to reduce time of transition of documents from one department to another. It has increased the communication between the health team members. It is also helping us to preserve the documents in a longer way. And it also adds value by having records available for future research. We have wearable technologies. Many home healthcare industries are using these wearable technologies to remotely monitor their patients, and patients themselves are using to monitor their parameters at home, these technologies. We have, I think yesterday we had a talk about DosiBed, so I would not like to talk more about it. This is remote vital parameter monitoring of the patients. Many hospitals, the leading hospitals in India have implemented this technology, and we had a great presentation yesterday to see what is the success of it. This is a new thing that don't know how many of you know. There's a cloud physician in Bangalore. This organization came up 4 years ago amidst COVID pandemic. These are two physicians who came from USA. They learned about this radar technology in USA. They brought it to India. They're using it to set up a remote critical care unit where they are providing expert services from doctors as well as nurses. They have started training nurses as well in use of this technology, and they are providing training support. During the COVID, they actually assisted ICU that was set up in Leh Ladakh, and this support was given from Bangalore city. And nurses are doing great job. These guys had come to my college to get some brilliant nurses to work with them. So this is technology that's really, I think, coming up and doing well. Smart devices, I think some of you must be aware, those who work in leading hospitals, you have smart infusion pumps that can control the rate, time, it can be patient control as well. So these devices are there. COVID also gave us a gift of telenursing, where I think a lot of us in corporate hospitals, government hospitals use telenursing to counsel patients, to triage patients and segregate them and decide who needs admission, who needs home care. But however, I think this needs to be continued. With regards to public health, this is a major achievement, I feel. In Chitradurga, we have this institute set up by Government of Karnataka. It's called as Center for Digital Health, Artificial Intelligence Research and Training Institute. They have come up with AI, ML-based devices that can actually monitor the major public health issues in India today is anemia. 65% of Indians are anemic. And this is a non-invasive HB monitoring device. It works on the similar technology that your pulse oximeter works. You just need to insert your finger, put it there for 30 seconds, and it gives you value of your HB, and it's almost 96% accurate. We tried it at our institute and it does wonders. I think for mass screening, this is very great device that can be used by nurses in public health. There's also AI-enabled stethoscopes that this institute has brought up. These stethoscopes help to detect murmurs. These are used, actually this institute has given these stethoscopes to CHOs, the community health officers, who are 80% of them, you know, they are nurses. And they are able to detect now if there are congenital heart diseases among school children. Not all children with congenital heart diseases are symptomatic. And these stethoscopes are now helping us to identify these children at the earliest so that they can be treated. These are several apps that Government of India actually developed, which have been successfully used in last few years. Some of you may be aware, some of you may not be aware. There's a TB Arogya Sathi app that we are using greatly in India. It helps tracking TB patient, it helps providing them incentives, it helps tracking how well they are taking their treatments. We have Niksha app that is also developed by Government of India that has been used by government. Shwasa is a mobile-based, AI/ML-based app which is developed by the Chitradurga Institute. It's a acoustic signal-based app wherein you download the app, nurses have it on their phone, and the patient is asked to cough into the device when the app asks for it. It detects whether the patient has an restrictive respiratory disease. It also generates a report whether he requires a referral. So all of these apps actually are for screening purposes where I feel the public health nurses play a very large role and they could be useful to detect things in time and have people referred. Last app, I think Poshan Abhiyan was launched again in 2018 by Government of India. This is an app that is used by CHOs as well as ASHA workers. They're using it. You can feed height, weight of the children and it analyzes and gives you whether the child is stunted, it is wasted or it is underweight. Whole analysis, but WHO parameters the app will give you. The map is another Poshan tracker app. It's very interesting. You just click a photo of a child and put it in this app, and app will tell you whether the child is malnourished or not. NIADA is an app where you click a photo of your inner canthus and it will tell you whether you're anemic or not, whether your dose of whatever medicines you're taking needs to be reduced or it needs to be increased. Niramai is an app that is developed based on thermal imaging, which tells you, I mean, there are a lot of ladies, you can see the numbers, 125,000 women so far are screened. It is on pilot basis. It actually non-invasively, painless device. It can tell you if somebody has, probably needs to go for a diagnostic test for cancer. This is screening device. ServiceScan similarly is screening for cervical cancers. These are major, major problems in India today. And these are used by nurses, so that's a great thing in community. Telemanus was a service, some of you must be aware, was launched by NIMHANS in, again, amidst of the pandemic, where 80% of the Telemanus counselors are nurses. It's a 24/7 helpline where people get counsel for their mental health issues. They can just call, and all Indian languages counseling is available for patients. Finally, coming to nursing education, I think this is very simple. Many of you must be aware, smart boards are now used in schools also, but given the budgets and the economy we have in India for especially nursing colleges, very few nursing colleges today, of course, are using smart boards. We have simulation technology. Every nursing college has a lab where you have low fidelity mannequins, but major colleges which have a medical college attached, they have high fidelity mannequins also, so that technology is used to educate nurses. COVID taught us how to teach our students online. Of course, it has its own drawbacks where you can't teach skills that effectively. But yes, it was helpful during the COVID at our place, especially we created our own videos and we uploaded, we shared them with students, and it was helpful to have students see something than nothing at all. So I think that was a great help. Virtual reality is just picking up in India. It's a bit expensive, but there are few institutions who have adopted it. I wouldn't say that it helps to enhance skills, but I have personally tried it out. It just probably helps you to memorize the sequence in which you need to do things and probably certain principles. But it would be, I think at this point, too expensive for most nursing education institutions to afford it in India. So to conclude, I have technology has a great future for healthcare. Nurses need training and support for use of technology, and technology can immensely help to improve patient safety, reduce time spent in non-nursing activities, and also bring better coordination of care. Thank you for patient listening.
Thanks, Sonali. We're going to give you a harder time because you ran out of time when we come to how many of those tools you've used, because I think the piece at the end that you brought up, which is some of these are too expensive for use, is actually critical. But I think if you're endorsing and showing us data, one of the things that I would request all people in any conference, because you're the champion for all the people there, is to test the tool and see how much it actually improves the quality of life. See, if it doesn't improve the quality of life, there's no value in you even talking about them. And what we've realized a lot is most of the time somebody has told us about a tool. So I think with that, let me pass it quickly to Biju before we actually have the useful piece of the conversation, which is challenging some of these paradigms, whether paper matters or tech matters. I think that's where the meat is. Go for it.
Good afternoon, everybody. And thank you for the Jyoti and Tangam for giving this particular this stage for me.
Apps are used by government, but these
Am I audible?
anemia
Yeah.
screening devices are not.
I just came this morning from Coimbatore to Chennai, and they have taken me in the flight, and I'm here safe. Whenever I see an aircraft, I always think of a hospital, because when you just get into a flight, you always think, God, let them land me properly, correct? Many of them have flew and came in here. And typically when a patient comes into your hospital, they always think, let them go back safe at home, right? And whenever you enter into your into your aircraft, who do you believe first? Yes? Okay, you believe the pilots, right? They have the vision, they know what, and they have the complete control of the aircraft, correct? And in a hospital, the administrators, I always refer to the administrators because they have the control over that. And they take care of you, and they will just make you fly, and they will make you land there properly. There are some beautiful crews, right? Who are they? I thought so that you will say, but actually they are the doctors, because they really take care of that, right? They are taking care of you in the hospital, and they also know how the hospital goes, right? There is something really invisible, okay, which is the propellers and the engine of the aircraft, which are the nurses, okay? Without them, the so-called hospital will not run at all. This is not a 50% rebate. Almost 50% of the workforce in any of the hospitals is nurses, because that says everything. I'll just tell you one small example of what I had. Okay, around 12 to 15 years back, my management asked me to develop a software for surgical site infection, right? So when I just went in, and the only way I have to get the surgical site infection is I have to ask the doctors, and no surgeon want to say that my patient is infected. One nurse from the infection control, she came in and asked me, sir, shall I give you some idea about that? Then I was just passionate to know what. She told very simple thing, that just from today, you have all the data in the computer, okay? Take today's discharges for the next 30 days, find out any antibiotics has been bought from that particular patient, and also find out whether any microbiology test is done and very cultures are positive. Even today, that is what is going on in our hospital, and we could find out the surgical site infection in a very, very good way. Nurses are decision makers, because on the day, on the moment, on the fly, they do a lot of decision making in terms of giving medications, okay, writing the documentation, okay, getting the lab test done, and they do a lot of work. And many times, at every moment of time, nurses are doing a lot of decisions. And they always identify the opportunities, okay. Basically, in our nursing side, okay, the nurses were doing a lot of non-nursing jobs. Somebody else was also speaking about that. They were doing a lot of non-nursing jobs. A lot of the nurses identified and they started automating the other processes so that the quality time has been spent for nursing, the so-called nursing, which is really missing here. And they are monitoring the patients, okay? The doctors come for the round in the morning and in the evening. Who is taking care of the patients? The nurses are the people who are taking care of the patients, and the nurses are monitoring the patient whether the patients are in the hospital or outside the hospital. And also, I have put in a lot of technology in the hospital, but who is overseeing that? I'll just give you an example. Okay, in our hospital, all vitals have been automated, right? It has been connected. Just by a push of a button, it automatically goes to the medical records. All your infusion pumps are automated. Okay, we have something called wearables. I saw a stall called Dosi here. Okay, they have non-connected, connected wearables. Nothing but you put the mat, okay, under your mattress. Okay, all your vitals, including your BP, your SpO2 and all, including the ECG will transfer to the other side. And everything is being taken care again by the nurses. And I just gone through a Journal of American Medical Informatics Association. It says that disappearing expertise in clinical automation, barcode medication administration, and nursing autonomy. The last one, what the conclusion is, information technology developers and healthcare organization managers should engage and have a better understanding of nursing. If that is not there, okay, I mean, somebody was talking that, okay, it is not working well just because we are not including the nurses into it. By the way, my topic is, should nurses be involved in technological advancement, okay? I think if you are a decision maker, if they can identify opportunities, if they can monitor the patients, if they can oversee automation, and if they can make every process simple and foolproof, okay, is there any question why can't they be a part of that? I mean, I've been in the Generation X, and there are a lot of people from Generation Alpha and Beta. Even the 2000 kids are in Generation Alpha and Beta. And in today morning session, somebody was talking, saying that whether the technology can replace nurses, definitely no. Okay, definitely technology cannot replace nurses. But if you don't understand the technology, the next generation nurses will replace you, right? The next generation nurses will replace you. The technology will not replace. And see, we all are talking about a lot of things like artificial intelligence, machine learning, and deep learning. We are working with, in our hospital, we are putting a lot of things. I'll just give you a small example, like we are trying to make X-ray AI enabled, okay? 85% of the X-rays are, okay, it's a normal X-rays, okay? So the computer can automatically identify that these are the normal X-rays and it can throw off. We don't want a radiologist to do it. So these things, I mean, the nurses should know, okay, what is the technology which is coming in, that's very important. And this is my medical informatics team. Okay, we have doctors, nurses, informatics specialists, and technology specialists. Most of them are nurses. Okay, believe me, most of them are nurses. What they do is they bridge the gap between technology and nurses. Unless and otherwise there is a gap being bridged, okay, the technology cannot be fulfilled in any of the hospital. To conclude, the nurses are the engines and propellers of the healthcare. They should not only be involved in the technological advancement, they have to be involved in the clinical advancement and the management advancements, because today I could see a lot of nurses is being in the pilot seat of the hospital. The sisters, I mean, in nursing, they are called sisters, but I could see that a motherly love which has been given to all the patients who have been coming in. With all due respect, thank you very much.
Thanks, Biju. I think that was quite nice. I think one of the lowest hanging fruits is folks and team at ANEI. You should grab him to do training on how nurses can be used to do technological evaluation, because this is not an easy skill to learn. And if you can do that with the help of somebody here, that's a paid training program that ANEI can do to a broader group. Hint, hint. But let's come back and maybe have we can do 5 minutes of a little bit of a conversation. We have some time, right? We bought 10 minutes, but we'll do 5 minutes. So let's ask this a little bit differently. in the last 10 years, has the peace of mind of a nurse improved or suffered in your hospital? Start with ma'am. You can answer. We can get another mic. We just give a mic there. Has it gone up or come down?
Peace of mind is a subjective word.
I'm asking your peace of mind, no?
My peace of mind has gone before.
It has already gone home. Or because you're an Annie, your peace of mind is good.
Better.
Better. Okay, so your peace of mind you're saying is improved.
Improved.
Sir?
You want a honest answer?
I want an honest answer.
No. Okay, because I'll tell you, because every day new things are coming up, okay? And unfortunately, things have been posted to the nurses. Now technology is getting slowly evolved, and we have to think in that particular perspective to make their peace of mind, they have to be in peace of mind. We have to work for it.
I think in certain areas you become more peaceful, and certain aspects where you have information overload because of technology, it is gone.
Sounds like a political answer. Up or down? Can I have hands up if you think it's your peace of mind is improved? I'm seeing like only Vincey's peace of mind is improved, huh? Okay, maybe there's a group there. Which hospital are you in, ma'am? You're not all Vincey, huh? Where?
Care.
MGM Health. So I think this is something that's interesting, because when we ask this, has productivity improved? Question one. Has it improved for nurses? Most of you will say it probably has, right, with EMR. Has it? Hands up if you think it's improved. I'm not seeing many hands up. Only MGM team is putting hand up. You're being paid to put hand up? No. No. Who else? Ma'am, that's all. Seriously, that means that 90% of you do not think your productivity has improved.
Can I just add on to this? Okay, I'll tell you one small example what we did in our hospital, which made it has been improved. Okay, previously, okay, the staff nurse is in charge of everything. Okay, even if they want a housekeeping staff, okay, the patient will come and ask the nurse. And if they want a coffee, they will just come and ask the, okay, it is like that. Okay, what we did is, okay, we have put a QR code in the rooms, okay, and whatever the service what they want, okay, they can just get that QR code and they can ask directly, so that it doesn't come to the nurse at all. And in fact, people were very happy about that.
But we have a very easy solution for this, what he was talking about, that calling for nurse or calling for other services. Simply a call bill, which has got different buttons. There is a marking that it is for nurse call or it is for other call, maybe housekeeping call, maybe something else. That itself can make the patient, we can educate patient, and patient can press it accordingly, according to the patient's need. And then it can be, we can reduce the number of calls for the nurses.
So I think,
only by
ma'am,
simply,
we're talking about, the good news is both of you are talking solution space. So hats off, because that's the solution space. So I have a challenge back to you. Who solves the customer problem in a hospital? Huh? Nurse, huh? So if you're the internal customer, who's solving your problem? You think a doctor is going to solve it? No.
no.
Ajita is very clear, Tangam is very clear.
No.
I'm sure if I look at Clara, no chance. Right? I don't mean you not doing it, but you don't believe doctor is going to solve it, right? You think management will solve it? They can add. So I will argue, here is the insight that this panel has given you. This world is getting more complex. You're now getting cyber security risk, which means that by accident, if a nurse brings a pen drive that she sees on the ground, which happened in, by the way, a nuclear plant in Iran, and plugs it in by accident into your computer, and the computer is hacked, what is the chance of the nursing holding on to that job? It's going to be zero. Huh? No, there is a pen drive port, right?
No, but no access in the organization.
So that's one example. So today, to hack my phone, nobody needs to touch my phone, right? It has to be near my phone. So I think the complexity of this world is getting high, which is why I actually appreciated this answer quite a lot. That if you are really the solution for your own challenge that's coming, you need to solve some simple things. I think the first key insight that we learned is, clearly the more paper you touch, the less automation you have, the more complex your world is going to become. Because the world is getting more complex. If you still have to touch paper, it's not helping you. One. So guys, save the tree. Don't buy Kleenex shares. Rather buy a technology share. That's useful one. Number two insight, you have to be involved in the decisions. And you have to be the owner of your own problems. I think that's one learning that we had even from ma'am's talk, that when she was talking about this simulation, her eyes lit up. Because she's the user and she's also seeing her students benefit from it. The others were public health tools. She's not the actual user. They're what the government has. Some of it she uses, like the anemia tool, that's true, right? But I think the logic here is you have to lead. This is the opportunity for many of you in the room. We had NABH quality, many of you are principal assessors today. That was one big growth, right? Many of you who have been assessors learnt a lot. Your next learning thing is technology, because nobody else is jumping up. Is the CTO team getting bigger in a hospital or smaller in a hospital? It's getting bigger, right? Guys, this is the opportunity. The other thing I would request, what I would expect Annie's leadership as executives is very clearly, and that's something you've heard from all three of them, come with a productivity score of what it is done in your hospital, right? Because that is validity. Has it really improved a person's life? That is where we will say, because I think there have been examples here, Dozy you've seen, you saw some examples of cloud physicians. Some of them have really improved life of some people, right? The call bell, it has improved life. The barcode, it has improved. So you can put a number to it. That is a recommendation we will seriously have. I think in light of staying, I'm going to ask for one final insight from each of you. If you had to do something to prepare the nurse of 2030 who is in her first leadership role, what would you advise her to learn now that will make her strong for the future? I will start here with ma'am.
I think she has to have her subject knowledge in place, and that will give her confidence, and that should get her going.
Only nursing subject knowledge. Okay. Step one, ma'am.
I think it should be like the person should be more rational in taking calls, because that is important. And for that, yes, what you said is knowledge is important. Knowledge has to be there, because domain knowledge can only help you in taking right decisions. So being rational, not jumping to everything that is coming in front of you and adopting it, by not seeing that whether it is going to yield any result. Without checking all this, I don't think we should adopt anything and everything coming in front of us. A leader should really go for it in detailed discussion and see that the impact of it, and then take the decision in every step.
Fantastic, sir.
I would love to say that they have to learn technology, but I differ. Because the nurses have to be nurses, okay? The nursing component of the nurses is missing nowadays. In at least in 2030, the nurses should be nurses by themselves. So that makes a difference.
Okay. So you kind of like heard, get your foundations right. Ma'am said that, sir saying that. Number two is, you do have to learn new skills. That's clear. He doesn't want to lose his job. That's why he's saying nurses shouldn't. I actually say that nurses are better placed to play a role. I'm not necessarily saying that they don't. But I think you should be part of the decision-making process. And I think that, ma'am, that's one of the biggest insights. If you're not part of the decision-making process, change the institute you work in. Because that institute should die. Let's be honest, they should die, right? If you're 50% of the population, you should be part of the decision-making process.
So just to add on to that, okay, we have a team, okay, I mean, I've just put in that photograph, okay, that team, most of them are nurses, and they are the real, I mean, bridge between the technology and the nurses. They go down to the nurses, and they understand technology very well, and they bridge the gap. And that's a real thing which we have to come up with.
So we didn't even have to answer it. There's no technology boon or bane. It is an aid to help you be more successful. But you are accountable for the life of yours as well as the customer. Remember that, please. And don't buy shares in a paper company. Thank you. Radhika, back to you. We're back on time.
Thank you so much.
Thank you. Thanks the panelists.
Thank you. If you can quickly scan it and give us your feedback about the conference, that would be really nice. All of you will be receiving your e-certificates only if you complete this formality.
Just 7. 7.